Hello, I'm Jessica Coburn, a member of the WNA Public Policy Council, as well as a certified nurse educator and a nurse educator of undergraduate and graduate students. Today, I'll guide you on how to prepare your students for Nurses Day at the Capitol. Thank you for supporting your students' understanding of the importance of legislation. At Nurses Day, students will learn how to engage with their legislators, deepen their knowledge of the political process, and understand the importance of supporting legislative policies that benefit nurses and our patients. For more information on anything that I'm covering in this presentation, please visit the Nurses Day at the Capitol website, linked at the bottom of this slide. The purpose of Nurses Day at the Capitol is to bring RNs together in person to learn about state legislative issues affecting nursing practice, education, and healthcare delivery. It's also an opportunity to network, build advocacy skills, increase the visibility and voice of Wisconsin nurses, and advocate for bills that improve outcomes in nursing practice, education, and healthcare delivery. Advocacy is a key competency for nursing students. This experience, Nurses Day, allows for the exploration of advocacy at a broader state level. Awareness of state and national policy issues improves students' advocacy skills. It improves their ability to discuss policy issues with legislators and other leaders, and improves their leadership skills overall. According to the AACN New Essentials, advocacy is the act or process of supporting a cause or a proposal. It's a pillar of nursing, and legislative and political advocacy is equally important to advancing patient care. Here's a list of the entry-level professional nursing education competencies related to Nurses Day at the Capitol. You'll see they're listed by competency, followed by a description of each. They include describing the policy development process, engaging in professional activities or professional organizations, recognizing the importance of nursing's contribution, and evaluating the effectiveness of advocacy actions. Here's our agenda for the morning of Nurses Day. Arrival begins at 7:15 a.m. and goes until 8:15. During this time, you'll check in and enjoy a continental breakfast and a wonderful exhibit hall. By 8:15, everyone should be seated in the ballroom for the day's overview, followed by the keynote address. Following the keynote, there are additional presentations and breakout sessions. Please note there is a scheduled break from 9:30 to 10:15 when you can visit the exhibit hall again or get some more breakfast. The morning programming ends at 12:30. At that time, everyone will eat lunch, which is on your own, and then walk the 2 blocks to the State Capitol building for our legislator meetings. Legislator meetings are scheduled individually with legislators and could occur anytime between 1 o'clock and 4 o'clock, but most of them occur between 1 and 2:30 or 3. Legislator meetings usually take place in their office unless there's an unusually large group. If that's the case, then it may be scheduled in a conference room. A floor plan linked here will help you get around the Capitol. WNA schedules the meetings with the legislators when you and your students register for Nurses Day. You'll receive the schedule on or before Nurses Day, including office numbers, times, and who you're meeting with. You could be meeting with staff if the legislator is not available that day. After the meetings, you can debrief in our WNA hearing room. That room number is to be determined, but will be available the day of Nurses Day. And in the room, you'll find WNA volunteers to discuss the meeting, how it went, what you thought about it. You'll fill out a short report form so that we have record of your visit, and you can also fill out a thank you note for your legislator. And then you'll receive a certificate of attendance. The certificate can be used to verify participation for your students if you can't make it to Nurses Day with them. Each year, WNA sets 3 priorities for Nurses Day at the Capitol. The priorities are set by the WNA Public Policy Council together with the Executive Director, based on what we think might be some of the most important pieces of legislation for the coming biennium. This year, the priorities, as determined by the Public Policy Council, are the environmental impact of data centers in Wisconsin, supporting clinician well-being, and the use of AI chatbots in healthcare. You will hear more about all three of these priorities at Nurses Day. Just as we have our students look up diagnoses and medications before a clinical experience, there are things that you can have your students do prior to coming to Nurses Day. I suggest they look up their legislators at the Wisconsin Legislature website. Once you enter your address to see who your legislators are, you can click on the More Info link and see the legislators' homepage. There you will find biographical information, a list of committees they serve on, and the bills they have sponsored or authored. This will give you a lot of information before you go in and meet them. In addition, you may want your students to look up some basic information about WNA's legislative priorities. Of course, they'll get more information about this at Nurses Day during the programming, but many students find that they get more out of the programming if they come in with a little bit of background information. And what can you have your students do after Nurses Day? Here's a sample reflection assignment on Nurses Day that they can complete afterwards, either in a post-conference or as a written assignment. The assignment asks them to identify a state or federal policy, not a hospital or systems policy, because we have plenty of those, and that is sometimes a point of confusion for students, but a state or federal policy that has impacted the health of their patients, themselves, or a loved one. It then has them explain how this legislation has impacted that person. It also asks them to consider how adding the nursing perspective to the legislative process could impact those outcomes. In short, why is it important that nurses have a voice in the legislative process, especially now that they have seen nurses advocating at Nurses Day? I've also included a sample rubric for written assignments that you can use or modify. Thank you so much for listening. We'll see you at Nurses Day at the Capitol. I hope this brief overview gave you a couple of ideas about how to prepare your students for Nurses Day. Thanks.